Hello, lovelies. Welcome to the Fat Joy podcast, where we talk each week about how to flourish in an anti-fat world. I'm Sophia, a fat person and professional coach who loves talking to other fat people about what it's like to live within oppressive systems that marginalize our bodies, and how we still dare to have the audacity and courage to reach towards our collective liberation and embrace our joy. Please know this is an adult content podcast, so there will be swears, we will be talking about harms we've experienced, and we will be rebelling against diet culture, anti-fatness, ableism, racism, etc. If you'd like to support the Fat Joy podcast and get bonus content as a thank you, please check us out at patreon.com/fatjoy. I am so glad you're here with us. Enjoy. Hello, everyone, and welcome back to the Fat Joy podcast. I'm Sophia, and I'm very excited to be joined by Dr. Vicky Borgia. Hello, Vicky.
Hello.
I want to share that I found out about you because you work with Dr. Rachel Milner, who appeared in season 2 as a guest, and we were chatting, and I just mentioned, I said, I'd really love to have a doctor on the show, and she said, I have the person that you need to talk to. And so she connected us. So shout out to Rachel. Thank you. And Vicky, I'm really honored that you're here. I'm so excited to get a doctor's perspective on the challenges that fat bodies face when it comes to the medical profession. Mm-hmm. So welcome.
Thank you. And yes, shout out to Rachel. Rachel's the best.
Yeah, she is. Mm-hmm. So Vicky, why don't you tell us a little bit about yourself?
So I am right now, I live on Lenape territory, Philadelphia. I have a direct primary care office in South Philadelphia. I grew up solidly middle class on Long Island in the 70s and 80s. And I did my undergrad at Columbia, where I always say at the dawn of intersectionality, because that article actually came out while I was there, and I was a women's studies major.
Oh, interesting.
Yeah, it really informed so many things.
Did you know you wanted to be a doctor when you were studying?
Yes, and actually, I was the first ever. So at Columbia at the time, I have no idea what it's like now. You had to have a major and then a concentration, right? You had your major and then you concentrated in something else. So I wanted my major to be women's studies and then a concentration in one of the sciences or all of those things. So if I were to do it concentrate in chemistry or biology, one of those things, I actually would have had to been in school forever to do all my prereqs and my women's studies things. So this is one of the first of many things that will probably date me. I went and I got oak tag and magic markers, and I made pie charts about how many courses I'd have to take to actually ever graduate, and how I wouldn't be able to afford that, nor would anyone. And so if you actually want people who study things like women and gender studies or any of the other ones at the time that were basically new majors, right? That you needed to be able to have a concentration, like a pre-med concentration. So my concentration were my prereqs, right? And so I was the first one. I got that established after coloring in pie charts and stuff. It was so cute. I went to my chair and I was like, see, this is what. And don't you actually want to have doctors who have studied all these things? So why don't you actually make it easy instead of this? Because this is a really expensive school and I won't be able to stay here for that long, right?
Yeah.
So I wouldn't have done it. Honestly, if I had to go back, I would not be a doctor. I'm just put that out there now because of how it is. And this is part of what we'll discuss. But there are so many other things that I probably would have done. I always saw myself as a organizer, except for the crippling social anxiety. But I would have not gone to med school after. And while my undergraduate degree and study since then informs everything about my life, my activism in college and in med school and things like that, it didn't make it easy. you know? Like I felt very much like an outsider.
I was going to say you were probably so different.
I was, and I really struggled in med school, especially the first 2 years until I found the queer med students group in New York. And then I led that. And then I found AMSA, which is the American Medical Students Association, a very progressive group of med students. And that saved me. And then I was on the board. I was the national LGBT. Actually, I added the T to that one. So it used to just be LGBT thing. And then so when I was there, we added the T. And so then I had like connections across the country and people that like my people, you know?
Yeah, to find your community.
Yeah. When you start doing clinical work, it was easier for me because it was actually with real people and I didn't have to hang. I used to joke that I watch The Simpsons every week because it gives me something to talk about with my meds classmates. I mean, I like The Simpsons too, but I was just like, otherwise, I don't know what we ever would talk about because our lives are so different.
Yeah. Well, and different ways of seeing the world.
Yeah. Very different ways of seeing the world. And, you know, frankly, a lot of my classmates also grew up on Long Island and were part of the reason I worked really hard to get out. And so it was difficult. It was absolutely difficult. I then went to a residency in Southern California that I found because of AMSA, very progressive residency. And then like, you know, it was much better because my people were there. I didn't need to like do stuff. Yeah. I call myself fat, loud, and cranky.
I love the cranky part so much.
I am all those things, mostly, right? So I am, I guess I'm cis. I call myself queer now, you know, because terminology has changed so much. I don't know if that terminology was around before when I came out, what I would have been. I am currently able-bodied, except I have no teeth, except for my dental adventure. But, you know, that could change on a dime. So there's that. I have 2 grown children, cis, white, male, privileged, athletic types, which I believe is my universe's journey. Right? I look back and I was like, yeah, I get it. That's my journey. Like the ultrasound with the first, when we saw the penis, I was like, ooh, I'm not really sure I know what to do with that. I actually have a degree in not penises. So let's see. And then by the second one, I was like, of course.
Yeah. A degree in not penises.
A degree in not penises, right? Like, I was like, my pedagogy has nothing to do with this. But it turned out okay. I mean, it turned out fine, obviously. I love my children. But that has actually been quite an interesting struggle. And to see how they're both really tall and they're athletic and they're
kind of like top of the body hierarchy, body ladder.
They are top of the ladder in the US or like in most of the world, right? They're upper middle class. They never really struggle with that thing. They are tall. They get okay grades, you know, like they are, if they weren't my children, you know. One time we were at a college tour and it was the 2 of them and one of their friends and they were all just kind of sitting and talking to themselves and I was kind of with the group and I sat them down and I was like, you know, when you do that, you're actually threatening to other people. And so you need to realize. So they think a lot about that and a lot about their privilege.
Yeah.
You know,
which is so good though. Like, it's great that you've kind of, and that I imagine that that's been part of the conversation as you've been raising them, right?
Always. My parenting philosophy is don't raise douchebags. I think I did it.
Yeah, good. Ours is don't raise little assholes. So same thing.
So it's the same thing, right? But I mean, like I have like, don't raise privileged douchebags because they could so easily become that. And they played a lot of sports where that is so big. So like I would give presents to coaches that were not full of toxic masculinity. I would send them thank you notes, to give them like beer. And so the reason I think I maybe did okay was my older son was coaching a middle school baseball team that's close to his college. And he got a thank you note from a mother basically saying, thank you for not being a toxic douchebag. And I was like, I don't. And he sent it to me because he was like, look. And so I sent this mother a thank you.
You did? I love.
Well, I don't think they're douchebags, but I'm sure the mothers of many douchebags also say that. So this is nice validation to know that he's also coaching in a way that is not toxic. And I was like, too bad you're too young, you know. I bought your coaches beers, but whatever.
Oh, that's so wonderful.
It's a really funny, it's a very funny experience too, because raising athletes who eat all the time and living in diet culture for so long, like switching over to like, now I make things that are like highly densely caloric with extra protein and things like that. Like it had to change, and it was surreal.
Yeah, was that part of your journey?
Yeah. It was definitely, so my journey, I can talk about like my relationship with the word fat, right? So I grew up on Long Island in the 80s, right? I think I probably had like a binge eating disorder really young when I think about it. And then, so fat was a bad word. Don't be fat. My mom was on constant diets, always talking about it. I was one of the people who went to Weight Watchers, not so young, but as like a teenager. And it was always thought about. When I was younger, I played softball, and I was really actually quite good, and I hit really well, and my coach started calling me a heavy hitter. And I think that did something really weird to my brain.
Just that word, heavy.
Heavy. Yeah, but he was a heavy hitter. So like, do they say this to like David Ortiz? Right? Like, you know, like that wouldn't be a thing. And I don't know if that's the timeline from it, but I really did start like restricting pretty severely. I would have to, so like, you know, don't be heavy. I had to, you know, it was like the era of like Brooke Shields, Jordache jeans.
Yes. Oh God, Jordache
Jordache, right. To have all those things. And I remember, you know, I restricted quite a bit. I had a paper route after school, and by Thursday I would eat an apple or else I would faint.
Oh.
So that was like through middle school. So nobody kind of noticed. And then I started purging. And so I would say I was bulimic from middle school to like the end of college. And because I'm a dork, I did a paper on it before starting it, bulimia.
Oh, interesting. Like you researched it before.
I researched it and I did it as a paper.
I don't think I've ever heard that before.
This is my dorky mind. But you know what? It was pretty good because I've been like, I should eat bananas. I got to keep my potassium okay. I don't want to die of a cardiac arrhythmia, right?
Nice.
And
oh my gosh.
So, and I sort of capped the end of this, although you know there's no real end, I think.
Yeah.
But in college, I wrote a chapter on eating disorders with another person in this handbook that we had. The Barnard-Columbia Women's Handbook, and I did the eating disorder chapter with someone who was pretty anorexic. And it was interesting because you know how that play on the skinny anorexic, and I was bulimic, and I was, at that point, actually, I wasn't even that bulimic, but my weight was up because I was okay with it.
Yeah.
And so there was a lot of that tension.
Yeah. Yeah. And that tension, just to name it, is basically that if you're fat, there's almost like I think what you're saying is there's almost a disbelief when fat people say I have an eating disorder. Yeah. Okay.
Also, it's not as great of an eating disorder to have as anorexia, because if you're the typical anorexic, even though we know that people can be anorexic at any weight, that's like, if there's just a privilege to that, right? Then the willpower of it, all the rest of the things, And great. And I went to a pretty competitive, ridiculous school too. So there was always competitiveness about that.
Yeah.
So at the end, it was probably like my last year of college was when I really started grappling a little more. And I still think fat was a bad word by college. And once I started doing more work about my own eating disorder and other issues, it got easier for me. Now I am very unapologetically very happy to say I'm fat, but I do have privilege because I'm like a small to medium fat.
Yeah.
So there is a way I want to make sure I say that, and I say that to depending on how patients are, I'll use that easily.
Yeah.
Unless I feel like they need me to couch it in like people with larger bodies or things like that.
Yeah. Depending on their own journey with the word. Yeah.
I like to reclaim fat. Like I like to reclaim dyke, and it's a joke because I have no frontal inhibition anymore. I'll call specialists that I'm about to send a person to, and I'll actually be like, so how are you with the fat dykes? And if they laugh, I know that's okay.
Yeah.
Sometimes they laugh. Sometimes they have to take a beat, and then they tell me like that they're okay with it. And sometimes they're just like, "Oh my god!" And then I know like it's probably not going to be it could be okay for some people, But my patient panel have been so traumatized. I don't think I have one person that hasn't had such medical trauma that if I could do that and save them the trauma.
Yes.
Whatever. It's also kind of funny to hear what people say.
I love that you shock them.
I know. Like, if you're ever going to call me, I'm probably going to talk like that anyhow. So you might as well know. I really can't. I'm basically unemployable at this stage in the game.
And is that why you started your own practice? Because I think you said when we were chatting before, you worked in a big institution for a while. Is that right?
I've worked in every kind of medical thing there is there, because all of it is exploitive and abusive to patients and doctors and nurses and MAs and PAs and NPs, right?
And is that because it's a business?
Yeah, it's because it's a business. I guess it's different in Canada. We all hear about the different struggles, but yeah. Our even not-for-profit is our medical industrial complex is for-profit, right? And so a lot of the reasons why I couldn't do what I do here in big places is because of money. It's because of things you have to click on the stupid EMR things. It's about what your bonus might be based on. That's something that really, I don't know if people know, but like there were two things that happened. So a bunch of years ago, when I was teaching at a residency, we had this program that all the people who had diabetes had to have their lipids checked, and they had to be certain numbers or whatever, right? And so we had a pharmacist, and she called everybody. She got everything. She did great. We all got bonuses. The next day, they changed the guidelines for lipid management in diabetes. And I was like, look at how arbitrary this is. Like, I can go on vacation because I got this bonus, but look at all this work that we did. None of our patients' lives, maybe some of them, if they had terrible cholesterol, it went down. But like, we're talking about little numbers that, did their lives change that much? Probably not, And that actually started me. I don't think I could do this now, how it is, especially in the US, but I would negotiate my contract so that I had more of a base salary and less of the bonus structure, because I knew I was never going to make the bonus structure because I just wasn't going to do the things that they wanted me to do.
Yeah, because so the things that so you doctors and health professionals would get bonuses based on if their patients lowered their lipid levels, like it was that kind of thing. That's like sales targets.
Yeah, it's like sales target. That was the one that was then. There's a lot of different things now. So like in the US, every time I send somebody to a specialist or whatever, they always will put like BMI addressed obesity. And then there's some sort of like made up thing they put in because you have to click it so that you get the points or whatever. And so even if that never happens, that's part of the reason. Although I did recently learn that when you refuse to be weighed, you're taken out of the denominator of that. So that's actually good for your docs. Not being weighed actually helps them, right? Because if it's like if you addressed it and you refuse the weight, right, then that could be helpful.
This whole idea is pretty abhorrent.
It's so perverted. So I have worked in mostly federally qualified health centers is what they're called here, like community health centers and look-alike community health centers. I've worked in two of the big systems here. I was on faculty at a residency for a while. And then I did urgent care, like in between these two things. And so the last job I had was urgent care. So, yeah, but it is all the way that the profit driven way medicine is done. Even if you take away all of the medical racism, sexism, fatphobia, homophobia, it's still never going to do it. And I was tired of seeing people like every 8 minutes.
That's what it was? Every 8 minutes?
Oh, you get like 15, but you got to like chart and stuff unless you're up all day. So I was working at a health center and I think I saw in one morning like 30 people.
Wow.
And I mean, it was a long morning. It was like probably till 1, but then it was in my neighborhood and I would see these people places and I just thought to myself, I could run one of these people down with my car later today and not remember that I saw them. Like honestly, I wouldn't even be able to like place you unless it was something huge or something very memorable. And that, you just can't, you can't be like that. Most people go into medicine. One, it's interesting scientifically, but it's for the relationship with people. And you take that away and it's just
assembly line.
It is assembly line medicine. And I had to get off the assembly line. So when I started my practice, the choices were leave medicine, leave the earth, or do direct primary care.
And I don't know what direct primary care is. Can you just explain that a bit?
Yeah, it's getting way more common in the US. So people think of concierge medicine. It is not that. But people pay me a membership fee monthly.
Oh, so instead of doing health insurance with their company, for example, they would do it with you?
No, I am legally bound to tell you I am not in insurance and people should have insurance.
Oh, okay. God, I just listened to the workplace wellness episode of Maintenance Phase that came out. So I've got like all the insurance-y stuff in my head right now.
So we recommend people have some insurance to cover for like catastrophic or things like that. So, right, I have to say that. But people can make their own judgment about what their risks are, right?
Yeah.
So I will tell people that you should have some coverage no matter. So your monthly fee to me gets you unlimited access to me. So I can get people in pretty quickly, except for now, there's a triple pandemic, but, mostly I can get people in a few days. I can have my first visit last 90 minutes. And follow-ups are somewhere between 30 and 45.
Oh, that's so great.
Yeah. And I have negotiated lab prices with LabCorp that are super cheap. And I dispense medicines from here that I got through wholesales things. So people save money in that way. Right. So people can use their insurance. And many people do. Like if you had to get an MRI, although honestly, I just paid $800 for my son's MRI with his insurance, with two insurances, in fact. Both me and my ex had covered him, and we still had to pay $800. So I probably could have gotten the cash one for $600, but whatever. So like if you needed big ticket items or surgery or things like that, like I'll advise people, like if you think this is a year that's coming up that you're going to need a lot of stuff, then we'll talk about what insurance might work best for you.
Oh, interesting.
I never bill insurance. I will do the certifications you need and get authorizations for meds if you want to use your insurance. And it reminds me why I don't want to work in that model, because it is just really everything is an obstacle. And then I, sort of choose how I grow and how fast and what happens, but I really am just my own. I can do what I want. And that's really the only way I can actually practice in a truly like weight neutral, fat positive way.
Yeah. Well, and let's talk about that. Like, what does that mean? Your website, I love your website. I was checking it out before we started talking, and I'd said to you before we start recording, I love that the kind of tagline is compassionate and respectful medical care. And I said, I'm deeply saddened that's like your unique factor as a clinical medical office.
As a clinical medical, yeah,
Whew.
I know.
Yeah. And grateful that you do it. And I'm curious because you also mentioned health at every size, gender affirming care, queer care. So curious about how is your office different? What are those?
Well, my office is actually beautiful for one. Let's start with that. It's not that beautiful right now. It's very messy. However, like my waiting room is gorgeous. If you want me to pull the thing around that you won't get, I have beautiful open windows. We covered them with like that film you do because I have a physical therapist who comes in and does some pay what you can visits here.
So a nice space.
A couch and a chair that has arms that were from somebody else's office. And then I have two other chairs that are armless and really high capacity.
Nice.
So when you walk in, it doesn't look like a doctor's office at all. I do have a scale because I do need to sometimes weigh people, mostly children, to give them the right dose of amoxicillin. But like, I never weigh anyone. It's in the back. It's fine. And then so I have lots of books, although many of them are borrowed and never returned. Like Joy Cox's book and also The Body Is Not an Apology. I should just buy them in bulk.
Yeah.
I never get them back.
I mean, that is a beautiful thing.
I mean, it is a beautiful, and I hope they go on to other people in the world, right? So, and then I have a bunch of children's books. And you will come into my office since usually it's just like one person. We can even start doing the history out in the waiting area because it's just like pleasant. It was actually quite difficult to get an office in South Philadelphia that had a bathroom that was accessible because the buildings are very old and like bathrooms are just like put on in weird ways. So like there was a gorgeous space I loved. And then I looked at the bathroom. It was like very oddly triangular. And I was like, nobody could get it. So, and nobody chose to make a triangular bathroom. So I'm sure there's no way around that. So I have two rooms. One of them is used by a therapist. And we also do some ketamine assisted therapy in there. And then my actual exam room, my pride and joy, the inanimate object I love a little too much is this table, my exam table that can hold, I think up to 600, goes up and down, does all the things. I can do inseminations. I can do IUDs. I can do all the things. The funny thing about that was I measured it when they were building out my office. And I was like, oh, great, it'll fit. What I didn't measure was my ass and the fact that I'd be at the end of the table. So I had to have the doors move out. I know. I was like, note to self, measure
your own ass.
Measure your own ass, because you're going to be doing procedures here. And so, like, I'm half sticking out. I got to lock the front door when I do that, but it is pretty funny. So it was so expensive, even used. And I, like, when I was just starting out, but honestly, why have a table that people can't get up on, that people will feel afraid of? Like, why would you do that just until you could get this table, right? So I do love it. I would disinfect it all the time. I was this close to buying like a conditioner for the material, and I was like, just stop.
You do love it.
I love it so much.
Well, as someone who, I've the last couple of years, I've been diagnosed with endometriosis. So I'm on tables all the time, right? And I've been on some and I'm like, oh, it's shaking. And I'm, reclining, legs up, they're putting things inside of me. And I'm like, please don't, like, I would be deeply harmed if, you've got the thing inside of me, the wand, and there's a fall. And also the narrowness of them. Like, I'm often like kind of hold it like.
Yeah, like when you have to have your arms, or you tuck your arms in, like a massage tables and things like that. Yeah, that you have to actually be aware of those things. Right. So I don't want that to be the case. And I have all of the different blood pressure cuffs just right there waiting. So I don't have to like look or do anything. I do want to get the conical ones. I just can't figure it out. That's going to be my next purchase. But so I have all the different sizes that people don't have to worry or think about. And my other chair in there is a, high capacity chair. What's not great about my office is there's a stoop outside, and they were going to like redo it and put a ramp. But I opened in November of 2019, and then they were like, well, we'll do it in the spring because there's something about contraction of concrete or whatever. And then like didn't happen. And now I might move into a bigger space later. So I'm like, oh, should I bother? I have a ramp like a portable thing that I have to put up. So it's not like truly accessible because of that, but inside it is. And I have a ramp to go back and things like that.
You've thought through so many details.
I did. I thought through a lot of it.
Did you? Yeah. Was it just based on your own experience, or like yeah.
Both my own as a patient and working in all those different places, So like when I worked in urgent care, I can't tell you how many people came in and was like, my knee hurts and I know it's because of my weight, or my throat hurts and I know it's because of my weight. And I'll be like, no, it's not any of those things. And feeling the need to preface that. Yeah. The charm offensive, be the good fatty, right? All that stuff. And I'd be like, explain again how your sore throat is because you're fat. Like, is it like fat in your throat? Like how does that happen? It's not even like anatomically a thing. So seeing that and seeing how inaccessible some places really were to people made me think about what I needed. And then, yeah, my scale doesn't go, I think my scale goes to 550, and I might get a bigger one for that. Not because I need to weigh people, nor do I, but I was thinking about it in terms of, I do sometimes like pre-op, and then I'm just forced to do it. But that I need to get that. And if I expand, I'm gonna have my old table is gonna be very jealous, but I'm gonna get the other table that's like that. I think goes to 800. Yeah. And then I'll have two of them. Yeah. I'll have like real tables. So yeah, and I also thought through a lot about like things I've done in other offices that were hard because I didn't have the necessary equipment, right? So, and I do a lot of like reproductive care, basically. So I'll do inseminations, I'll do IUDs, and for people in larger bodies, you need other equipment and you need to be able to do that. So
Yeah.
I'm
Does that equipment exist?
well, it depends. So like what I have for sometimes what happens with like IUDs and inseminations, IUDs mostly, the walls will come in, and like I don't know if people have had the condom on the speculum to try to do it. I think that does nothing. So I got a different kind of speculum that is longer but not bigger, because you know how like you don't need a ginormous big one in terms of width. I just need something that is longer to be able to see, right? And then I have these retractors that you use if you're doing a procedure called a leap, where you take a little bit off of the cervix. And I have actually found them to be quite comfortable for people. So that's helpful for some of the things, like instead of trying to do the stupid condom thing on the speculum.
Yeah.
So they don't exist specifically for it, but I'm just trying to like figure it out as I go along.
Yeah.
Right.
That's so great. I mean, it's interesting, just even in my own journey with endometriosis, my gynecologist, she said, well, if you need surgery, I can't do it because of your BMI. You have to go to Mount Sinai in Toronto. I guess and it turns out that's okay, because actually she was not an endo specialist. And I have since learned that if you're going to have surgery, you need like a trained professional, because most gynaes, they're just not trained in it, right? They don't do it all the time. But it was a very interesting feeling being told that my body, and she didn't go into details, but would not work within any surgical suite. So then that started then I started to think, oh God, but what if this endo cyst that's on my ovary, what if it explodes? And what if I need immediate surgery and I live in a small town? Like, am I now, my standard of care is depleted because the instruments won't work, the doctors won't know what to do, how to work with my body, like all of these stressors.
Is it the exam table? Like those things can be changed, but that's on us. That's on medicine. Like, have the right equipment, train in the right way to do it. Like honestly, medical schools, we learn our trade off the bodies of the disenfranchised. That is absolutely true, because med schools, community hospitals, like I did my medical training at downstate, really very, very poor people, very marginalized people. Like I think that people don't think so much about that, what a debt we owe, right? Because like that's how we learn our trade, right? And so if we can do that in med school, and they're better now in terms of some stuff, like microaggressions and things like that. And for other things, not really for fat people, might come. But like if we could think of changing the paradigms as we're doing now, like a good example is the differences in creatinine clearance that they have in labs. I don't know if you've read about this, but so it's one of the reasons why like if you put in that someone is Black, they actually calculate it differently. And so this is why Black people don't get as many renal transplants, don't get as many kidney transplants. And it's not based on anything, much like the BMI is not based on anything. And so there's a movement now, but it keeps them away from getting care or earlier care, right? Like, so you're not on that list. And that is actually changing now. And now sometimes you'll get labs that are like, we're still using the blah, blah, like in a little apology on it. We're still using the other blah, blah, blah for this, right? So, things change. Like even with like gender affirming care. So I've been in medicine for 20-ish years, and it is so different from that now than it was. So I have a little bit of hope, not a lot of hope, because I don't have a lot of hope in humanity, but this like thing that happened, that changed really pretty rapidly, and more recently, like the acceleration of it really does make me feel like there can be other changes. I mean, things aren't going to change in the big systems because of capitalism.
Yeah.
Right?
Yeah.
That's really just it.
Yeah. Well, it's interesting. In my conversation with Reagan Chastain, we were talking about gender affirming surgeries and how so many fat people are denied because of BMI. And it's basically like held over you, where it's like, well, get your BMI down to XYZ and then we'll grant you. I mean, it's.
And I actually had a student this summer call around for surgery, just for top surgeries, so to see like if people had BMI limits and if what they were, if they had them, and why. And it's actually better around here. It is better. There are people who are there like BMI. It doesn't matter. And then I try to send them people for breast reduction. They say, no, you have to get to a BMI of that. And I was like, so what's that? Why is it different? Right?
Yeah.
But I know.
Do you argue with them? Do you call and fight with them?
Argue with them about that? I do, but it's not going to get like it's me against 10. Come on. So I had a patient too that had a super traumatizing event because I sent them somewhere to get a tubal, or we take the tubes out now.
Mm-hmm.
After Dobbs, many people wanted to be sterilized, and
what's Dobbs? I don't
Dobbs, is a terrible thing that befell. It got rid of Roe v. Wade, so abortion access, right? So yeah. So many surgeons who would gatekeep around that, you had to be a certain age and see if because you can't decide whether you want kids, whatever. I mean, I thought all of that was ridiculous too, but then that actually loosened a lot of that up. So I sent someone to talk about it with a patient, and she came back just in tears about how terrible they said that if she would die because her BMI is so high. And this is someone who's a little bit celebrated on social media for things and will no longer get referrals from me. But then I sent her to this other person that I love in a medical way. And he was like, no, of course we can do it. We'll schedule it for like the 12th or whatever. So, I mean, she got what she needed, but that's the thing. So it's completely and totally arbitrary. And it really just depends on like what you're willing to do. So like, I will tell my patients, I'm happy to try to do this. I don't know if I'll be able to do this, but we can try and we can see. And if I need another set of hands to like pull back stuff or whatever, you want a friend to come and help me if we need to like pull part of your belly or something like that, like then that's fine. But like, why, if it's so arbitrary, I could talk a long time about that. However, I do have a spreadsheet for the Philadelphia area for top surgery and a lot of other people and their BMIs, because I had an awesome med student who did that for me.
Well, those resources, those kind of community sharing resources, I've tapped into all of those as well. Different Facebook groups, and people post. You end up creating your own community wisdom of people who won't make you feel like shit about your body. Yeah. Wow. That's great.
That's exactly.
I'm curious about are there any risks, challenges to running your practice the way you do? Like really, because you're taking a hard line here. You're basically saying all bodies are welcome, and I'm not participating in, anti-fatness and anti-trans, and, so what are the challenges?
In the end, I am an allopathic physician. I trained at an allopathic med school. I'm going to use medicine if you need medicine, right? Like, I'm not going to give you medicine because your A1C is in the made up pre-diabetes land, right?
Yes.
Because that's marketing.
Oh, I'm going to have you say more about that too after.
So we could talk about your options. We could do all that. But I mean, in the end of the day, I have some training in integrative medicine. I believe in, some things, not other things. I have opinions about functional medicine, whatever.
Yeah.
But in the end, I'm an allopathic doc. So what I do is actually see the people who haven't been seen for 10 years because they had a traumatic experience. I get them into care. We do however people can do it. Sometimes everything we can do the first visit. Sometimes people can't do their blood pressure yet. I have a patient who I have not gotten a blood pressure on, but now we get the cuff on, and that's a good start. You know,
because the trauma they've experienced is so significant.
And they're so anxious about having that happen to them, and I know if I keep doing it, I'll get it. And if I force her to do it, she won't come back. And then who the hell knows what her blood pressure will be? So, like, I don't know what her blood pressure is, but I will one day.
Mm-hmm.
And, I'm okay with that, because as if it wasn't that, it would be no days. No one would know what it was, right? So, I'll see people. We'll do the 90-minute visit mostly because everyone cries. Sometimes it's also me. And then kind of figure out people's history. And this is, people are so traumatized that it's hard. And then I will do all the things allopathic physicians do, except weigh you, and we'll address them in however you want to address it, right? So people have high blood pressure, people have diabetes, but that's like everyone. Not just like, right? Because everyone gets those things no matter what your BMI is, right? So, and I actually don't think that, I think my numbers are probably the same, if not a little better than when I was at the FQHC, although those were mostly newer immigrants from Mexico. And I think that they probably didn't have care, but I feel like if I ever had any extra time and I ran my numbers, I actually think it would be similar to other primary care places that I've worked.
Yeah. And when you say your numbers, do you mean like people's...
How many people have diabetes? How many people have high blood pressure? How many people have high cholesterol? Like, I really think it's the same.
Yeah.
But people are so afraid because you walk in assuming that that's what it's going to be, right? And so, but I really think it's similar, honestly.
Well, which that backs up a lot of the research, which is there's no disease that only happens to fat people. It's like,
it's just that they're been treated shitty and they don't go to care.
Yeah.
So maybe I will get somebody whose A1C is super high. Although honestly, I really haven't.
Yeah.
Those are the sorts of things.
Yeah, I thought it was so interesting what you said, because this whole like pre-diabetes thing is such a bugaboo of mine. Can you say more about how pre-diabetes A1C levels, is it the whole concept of pre-diabetes is all marketing and bullshit? Like, is that, what are your thoughts on that piece?
My thoughts are like when real estate people rename neighborhoods. That's what I call it. So we had a neighborhood here called Graduate Hospital, which is now called Rittenhouse South, because Rittenhouse is a fancy neighborhood, It's like Dumbo or any of the real estate things that we make the hot new neighborhood. That's what I think they did. They rebranded it, they marketed it with the help of, the drug companies.
Novo Nordisk and their insulin?
Yeah. Yeah. We'll just say it. And then they marketed it as like, now you have this disease, but everyone has something because we're humans, right? Like I have hit by a car when I leave here. How would I know, right? But don't we all have something?
Right.
Some people have more risks of things, but everyone is a something,
right?
Even if you get it, well, like pre-diabetes. 2/3 of people don't get diabetes. So really, what are they what?
Yeah.
Right? Like that's the whole thing. It means something that if your A1C is higher, and I'm not going to pretend like it doesn't mean anything, but it doesn't mean you need to be on meds, and it doesn't mean you are going to get diabetes, and it doesn't mean any of that. It's basically, Dumbo or whatever the newest neighborhood in your own city is, right? We did a similar thing a decade or two ago about osteopenia. That all of a sudden became like a disease. And then it's pretty old, but I think it was the New York Times, a great article about osteopenia became a disease when they figured out how to make really small scans. So osteopenia is when your bones are thinner, but not osteoporosis.
Oh, so like
Okay?
pre-osteoporotic.
It's pre-osteoporosis, exactly. And that became a thing when they were able to create and market these little machines that people could do quick, like bone density things in the offices. And then guess what? I have a med for you to take for your osteopenia. And now you can have a medication. So they would give these things to doctors' offices so they could diagnose new things. I mean, think about that happens all the time. And now, in the US, we have direct to consumer advertising for all these drugs too. So you have that. So yeah, prediabetes really pisses me off.
Yeah. Well, and so when there's something like, let's say, prediabetes, someone has come, they've been, oh, I heard this, I was diagnosed apparently, and now they're coming to you. I imagine what I'm about to say is very true. I'm just going to say it though for everyone listening. So typically a primary care physician, a family doctor would immediately say to someone who's pre-diabetic and fat or, has a higher than normal BMI, the first thing they would say, the intervention would be, well, you immediately have to lose weight by any means possible. You don't do that. Same with like fatty liver, like all these things. So what do you do
also
instead?
Because that's not doing it.
No.
I don't say it not because of that, because also like we know it fails. I used to say this, but I think I shouldn't anymore. But like if there was a medicine that we knew worked 5% of the time, would you be okay prescribing it all the time?
No, you wouldn't.
Right. So why are we like prescribing that when we know it fails and it makes things worse? The reason I'm saying I maybe have to scrap that is because of that Alzheimer's drug that the FDA approved that really has terrible evidence for it. So maybe we do it a lot and we don't know about it, but know better, do better. Like why would I tell you to, also that's stupid. Like as if people haven't tried that before. It's like telling someone that doctors talk about this too in like some of the social media things that I try to avoid. Doctors feel like it's a responsibility to tell people that they're fat. And I'm like, hi, we live in this world. We all know we're fat. We all like, you think that hasn't occurred to us before? Oh, yeah. Maybe I should lose weight. Everything is at us to lose weight in the world. You have to actively work to not buy into that.
Oh, yeah.
So telling someone lose weight is like, it's a nothing. But you got 8 minutes with them. You could move on, you could chart, and then you're not charting. They call it pedometime when we chart at home. You're not doing the 2 or 3 hours of charting that most docs have to do at home.
Oh my gosh.
Yeah.
Yeah.
I mean, that is sort of why people do that, because it is the easiest way to get people out of the room. And I'm not going to lie.
Yeah.
It's hard to be in healthcare right now.
Mm-hmm.
Everyone is dysregulated.
Yeah.
Everyone is sick. I have an almost completely vaccinated population. I have so many people with COVID right now.
Mm-hmm.
So like, all of that on top of it, if I saw you and I'd be like, oh, lose weight and come back in 6 months. I just basically did it to buy myself time, and also we're told that would help, but
yeah,
it doesn't.
I mean, it doesn't.
No, and it harms, and we do harm. Yeah.
Yeah.
Why would we want to do that?
Oh, yeah. So for people listening who can't come to you in your beautiful practice, do you have some tips, some ways that we can advocate for ourselves in medical situations?
So I'm glad I'm following Ray and Chastain, because those health sheets are amazing, and everyone should print them, the whole set out, and give it to every doctor you meet.
Oh, why haven't I done that? Oh my gosh, I'm going to do that the next time I go to my GP.
Print out the whole entire set, and then there's links on it. It's not like you can't see the primary source material if you don't want to, right? I would definitely do that. I would always say, please don't weigh me. And you can get those please don't weigh me cards also. Personally, I have done many different things not to be weighed. Let's face that I have a ton of privilege because I am a doctor going to medical things, and like my primary care person is my friend. It's hard to not be, like in that world with that. But I can say things that other people really wouldn't be able to do. And also there's less of that power differential. I know I'm the patient, but I also am still a doctor, right? So like at one point somebody argued with me and I just said, the last time I said I would be weighed at the doctor's office, my bulimia came back. And that really shut them up. It was a lie, but whatever. But if you can like give them direct examples of the harm they will actually cause you, you'd be like, my eating disorder came back.
Oof.
It's a little manipulative, but I wanted to be like, I'm not doing it. There's zero reason to do it. So like you could argue about like, well, are you going to prescribe me a medicine that you actually need my weight for because I'm not a child?
Yeah.
Are you going to like, how is this going to change my care?
Yeah.
And then I guess I would actually have to look this up. I will try to find this because telling people that if you refuse and then it's out of the denominator, it will actually help some of their scores. I think they would do it less.
So give them an ROI.
Yeah, right.
Oh,
exactly.
gosh.
So I would do that. I would call beforehand and ask, but that's very difficult to do, right? To have the courage to call to see, is this accessible? What does your waiting room look like? Will I have to bring, things?
Yeah. I've tried to do that and I found that the people didn't really understand my questions. I would say, look, I'm a fat person. Is there like I would ask, but unless I don't know, it was like they didn't know what I was asking. They're like, oh yeah, no problem. Then I get there, I'm like, oh no problem. Like, I'm coming for, I had to do a sonohistogram, the thing where they put the water into you. And it was I hadn't had that level of procedure before. And I said, okay, so will the bed work? What the gown situation? Like, and they were like, oh, it's totally fine. I get there and no, it was not fine. They were like, oh, we can fit all bodies. I'm like, okay.
What does that mean? If you don't have a gown that fit. Oh yeah, I was called out about my gown by somebody because I have gowns that go up to as big as you can get them, but they're cloth, and so I have to wash them at my house.
Yeah.
Someone came in and I didn't have the right size, and I was like, yeah, I'm not even wearing clean underwear, so like it has way more to do with doing my laundry. And I apologize. I've been much better since then. Like I will do them right away.
Yeah. Oh, that's great. Well, and the fact that you even have the different sizes, like again, I've probably had, I don't know, 20 ultrasounds in the last, few years. And I don't think I've been to a place yet. And I'm like medium large fat. And there's still nothing that fits my body. I've been to hospitals, I've been to clinics, I've been to like specific ultrasound clinics, like so many different settings.
I've also given them to people or, let them borrow it. You can buy them on Amazon. I mean, I got mine on Amazon.
Oh my God, kind of like how I take my own seatbelt extender. I should just take my own hospital gown.
Take your own gown. And this way, I was thinking of that because someone who I work with a lot too, with Rachel, asked me about that. One of her clients needed to go to derm and they were really worried because the last time they went, there really was not a gown for them. So I just gave a gown. I'm like, it's probably a good investment. So people could take them when they go to specialists and hopefully bring them back. Laundered, I hope.
I have had someone say, I said, this gown doesn't fit, so I'm just going to keep my clothing. And they said, no, it's not sterile. And so there was they kind of...
My gown's not sterile.
Right? I was like, did you sterilize this gown? There's a lot of battles.
There's a lot of made up stuff.
A lot of made up stuff.
When you go to the doctor and they'll say things like that, the classic is, what advice would you give me if I was in a smaller size body? Right?
Yeah.
That's that. There's the other, you could say, we know that no diets work. And so telling me to do this basically means you're not doing any intervention.
Mm-hmm.
Or you can say, okay, so aside from that, what else would you recommend? Right? And see what happens.
Yeah.
Or you can say, okay, can you please note in my chart that you're refusing me care because of my stress?
Yeah.
That's like what we always do for insurance companies that deny somebody something they need. I'm like, oh, thank you. Can you please give me your name so I can chart it when in case there's litigation for delaying care?
Does that change anything for the?
Oh yeah, it always helps. It always helps. But I'm not going to start by threatening everybody. But if I'm all the way in there and I think so, I don't order a lot of things that need pre-certification, although lately I do. I'm not that much of a outside testy kind of doc. People need MRIs and things like that. And so I don't know, I have this book. This is also very Philadelphia based. Jefferson has MRI machines and the capacity of the tables are really good. Some of them are really quite fine.
Good.
So, I also had another person call around to try to see about that and CT scan. So at least I would know where to
send people.
Yeah. So saying, well, what would you do testing on someone else? The classic on this is knee pain or hip pain, right? Or back pain. Who doesn't have back pain?
Everyone I know has back pain.
Right? And what do they call it? Pandemic ass now?
Yeah.
Yeah. So, what would you do other than that? And then, if they say, oh, I'd send you to PT, be like, all right, great. I love PT. Send me to PT.
Mm-hmm.
He's great.
Yeah.
The other thing that I think a lot about is specialty care, right?
Mm.
And so when I have to send people, I get very nervous about it because I don't want to cause harm. I really caused harm to that patient who wanted a tubal. And her blood pressure spiked, all of the things. It was just terrible. And so knowing that you're doing that, I'm trying to get over that, right? I can't control those things. But talking to everyone trying to find that community. And as much as I don't want to be on any social media, sometimes it's very helpful in those cases,
Yeah.
Yeah. So I think that I also had a patient who had a bad experience with a specialist. And I told her, and I was like, they said something about, oh, well, are you on a medicine for weight loss yet? Right. And, or wanted to prescribe something for weight loss. Yeah. It was kind of ridiculous. And, so this person didn't want to go back. And I said, I think you should write something. And if you feel like you can't send it, don't send it, but at least you've written it down. But then they sent it as an email and they got an apology and they were like, we'll never talk about it again. So it's you see, people are teachable. Nobody goes into med school to hate on people.
Yeah.
Med school makes you hate on people, but nobody starts it to be oh, I want to be a doctor so I can be an asshole.
Yeah. Well, we get so indoctrinated non-consensually. The research is lies a lot of the time. Yeah. So it's
lies, and people are under unbelievable amounts of stress the way that we do medicine now, and so give people the benefit of the doubt. Maybe once I'm talking about myself when I'm trying to do this. Everyone is dysregulated, right? The years have been rough. We're all extremely dysregulated. Sometimes I won't send an email or even a message on the portal to someone until I've slept, when I'm like, oh yeah, you're not in a good place. And so, I'll get called out on stuff and I'll be like, oh yeah, you're right. That was terrible. And I'm sorry. And I'll try to make up and do what I need to do. Right. So people if you give somebody the opportunity to be like that, please don't mention that again, or I'm working in a different paradigm now. Can we do that? So that's another thing. And that was actually a very positive experience that happened. Who knows? We'll see what happens when they go back to that specialist. But the idea that like don't discount a doc immediately because, the patient that they saw right before you might have been like super complicated or terrible or whatever, and all the people that they're seeing. So I have a little compassion at first and give it a try. And then if they're still a jerk, move on.
Yeah, that's beautiful. I love that, Vicky. Thank you. Those are great, great tips.
My other tip that I do with people is I'll coach them before if we need to. Mostly pregnant people. That is like the worst. Oh, God.
Yeah. I have a whole episode about fat pregnancy that I did in season 1. It's brutal. Yeah.
God, I'm so happy I had my kids so long ago. Like, all this stuff, like, honestly. And I also had my children in Northern California, so it was a very different experience than here. But we'll play the game. And we'll play like that. I'm going to tell you how you're going to have preeclampsia and your baby's going to die. I should do all these things. And you're going to tell me what you're going to say. You know what I mean? Like we did that.
That's
and
good.
If all else fails, it's the smile and wave. Like if I have people who have Medicaid, I can't order a sleep study on them. And so they have to see somebody. And I'm like, they're going to talk to you about that. And you're going to smile and wave and be like, okay, when are we doing the sleep study?
Yeah. Yeah.
And be done. Right. And unfortunately, you have to smile and wave a lot to get what you want. So like, I'll be very, very upfront with people. I was like, I want you to go to cardiology and we want an echocardiogram and a monitor. And then anything else you say, sure, okay, whatever. And then just don't do it.
Yeah.
And then
till we get the results, then we go from there.
Right.
Yeah.
And then, like we are doing it we have our goals in mind, know that it might be shitty, but that's the goal.
That's great.
If we can get those things done that we need, then you get it done. Like I think about this a lot because sometimes I play the O word game too, right? Like when COVID vaccines came out, I was like, fuck it, everybody go, get it.
Mm-hmm.
That's not even true, but by the time COVID vaccines came out, we knew that wasn't even true. But
yeah. Oh, I got early and my partner did too. I was like, he's my caregiver. Let's take advantage.
Hop on that train,
yeah.
And I'll do it for like people to use their FSA for gym membership. But they know, and I say, I'm going to use that word because it'll get you what you want. But like, I'm not going to have it in my chart otherwise.
Yeah. What I hear is so much gentleness there. There's like a gentleness, there's an equipping people, and there's a real recognition of, look, it's not right, but we live in this world. And so here's how we can do it with as minimal harm, as safe as possible that we can in this moment. That's so powerful, Vicky.
That's sort of what it's harm reduction.
Harm reduction, yeah.
That's how we're practicing, harm reduction.
That's great.
Also, when I was at an FQHC, I was like yelled at twice about some woman's A1C that wasn't getting controlled. She was in the most abusive relationship ever. And I just looked at, this was like my chair. And I looked at her and I was like, she's not going to live long enough for diabetes to kill her. Her partner's killing her. And I was like, you could talk to me all you want about her A1C, but I've been working on other things that'll be more important, right? So like you can have an A1C of 6.5 or 6.8, and to have an A1C of 6.5, your life is miserable and you're restricting and you're basically eating disordered, right?
Mm-hmm.
Or you can be okay in your body and not be restricted or thinking about carbs, calories, all those stuff all the time.
Mm-hmm.
And you will probably be just as fine.
Right. Yeah. It's so good to hear a doctor say that.
But some of those numbers are so arbitrary, and I've seen them change, and I see the pendulum go back and forth.
This is the thing.
Right? It's like when you're in training and you work with one attending and they're like, you have to do it this way. This is the only way to do it. This is how you do it. The next time you're on call, you're with a different attending and I'm like, this is the only way to do it. And it's the exact opposite of how the other attending did it. And so and then, sometimes they yell at you because you did it exactly the way the other attending told you was the way to do it, right? And then you got to realize, okay, so really there is no only way to do it, because there's no only way to do anything.
No. And our bodies are so different. Like I take a med, and even just biochemistry, like I've tried 4 drugs for endometriosis. The ones that worked so well for other people did not work for me, and vice versa. Like
otherwise there'd be one drug.
Otherwise, there'd be one
everything. There'd
drug.
be one drug.
That's right.
There'd be more, because every time that one went off patent,
then it would be
one molecule and call it something different, but it would be the same drug the whole entire time.
Exactly. Oh my gosh.
But yeah, like there's body. Look at the world. There's diversity in everything. There's body diversity. There's things like that. Like I don't really hang out with like the mainstream medical people, right? But it was really super interesting I went to Montreal for the WPATH conference, the World Professional Association. I don't even know what it is, but it's the biggest trans conference that was international. Mm-hmm. And like even the whole language was so different. It's like the language that I live in now. And then I went to some stupid thing I had to do to renew my license. I was like, wow. It's so different, right? Like in the fat activist world, we all accept that there's body diversity. In the queer world, we accept that there's so much diversity in terms of sexuality and gender and neurodiversity and all that stuff, and everything is like, it's so different just depending on which community you're in.
It's true.
Whatever's going to work for you is going to work for you. And also, it's not me. I'm not the person. Like, I have my own stuff to deal with. I'm not going to choose what you deal with. I can hardly choose to do the stuff that I need to deal with for myself. You know what I mean? Like I'm going to give you your options, and you can choose which one makes sense for you.
Yeah. Oh, so good. Oh, Vicky, thank you. I want to move us to joy, because I am so curious. What connects you to joy? How do you, again, you work in a really challenging environment. So how do you stay connected to joy?
I am trying to find little bits of joy now. I find joy in my patients in many ways, mostly because they're really pretty kick-ass. Most of them are kind of activists and do things for other people. And so seeing that is really makes me so, it restores a little bit of my faith in them. Mm-hmm. Still not high. But that actually brings me quite a bit of joy. And then the other things I was trying to think about this. I broke my teeth. I crowned on my teeth and I fell scootering in Washington, D.C., not this summer, but the summer before. But you know what? 5 minutes before, I was like, this is one of the funnest things I've done in so long. I was like, I'm having so much fun. I'll do it again. I'm still going to do it again. I did it again a little bit when I was on vacation. I was in Denver, but not for that long. And even though this has been a terrible adventure all this time, but I did that because my kids were always saying, oh, you should do this with us. And I would always say, no, you do it. And then I was like, oh, I could do it. And part of that is like, I am concerned about weight limits. Am I going to fit? Is this a thing that I'm actually going to be able to do? So I am going to do more when my kids say, oh, yeah, you should do this too.
That's great.
That's how I'm going to have joy.
Yeah.
I had joy, plus and minus anxiety, last spring because I started to play softball again.
Oh.
Yeah, because I was like, you know what? My eating disorder took softball away from me, and I kind of love softball. I was doing a diabetes class with people, and one of the pitchers was like, oh, my parents made me do all these like organized sports. And I was like, oh, I love softball. Mm-hmm. I think it's because I also was a little bit in love with one of the pitchers, the whole baby dyke stereotype of it, whatever. But I really did love it before my eating disorder kind of took that away from me.
Yeah.
So that I find joy for it. I'm hopefully going to be able to do it again, but it depends on what happens in my mouth. And then I am finding, I found joy yesterday because I could eat pizza cut up for toddlers, and that was really delicious and wonderful.
Yay, pizza.
And right, couldn't do anything for so long. And I find a lot of joy in my kids, actually. And I think that so like when my son who's at school comes home, and if he actually wants to hang out, like that also brings me joy. I will also be very happy when we can go out to eat outside again when it's not so cold. That has been bringing me some joy to connect with people person to person.
Those are beautiful.
I know, and I do need to think about this more. I always do. I have been thinking about this ever since. Like joy. I sometimes like I'll be walking home and the sun will be setting, and that's beautiful. Like those sorts of things. Like little tiny moments that you're like, oh, this is lovely. Yeah.
Yeah, those totally count.
Those sort of things that get you through. Like I have come to the realization a little late in the game that I really have to not schedule things for like December through February, because it's probably just not going to happen. I probably have too much, especially if we're to go into another year where COVID surges in there. I'm just going to have to not do it and then get through,
Yeah, that's some good self-care.
Yeah. I didn't.
Your future self will thank your past self for that.
My future self will, like my last year's self sent a message to this year's self through my calendar about scheduling more sick spots. I was like, thank you, past self. That was very helpful of you. I know. This I'm not doing anything was not my idea. I'm in a pretty awesome little business coaching group, and it was actually someone else's idea because I was like, I took these days and I didn't do anything and I don't feel refreshed. And then I was like, I want an A++ in relaxation. And I said, right. So just like, Body Trust, those amazing people.
Yeah.
Right. C-. I always say C+ work, but like C- work. I want to do the C's get degrees way.
Yeah.
For a lot of things.
Yeah.
And that this person in my group really said, what if you just accepted that these are never going to be easy months? And I'm like, yeah, you're right. I think I had more expectations. Like when you're in urgent care, the winter is terrible and you do it for the summer, which is quite nice. And actually I did a lot of the work about building my own business during the summer. But you do the winters because the summers are good, but now the summers are like the winters. So why would you bother? Right. So I'm just going to be okay with that and then figure out like, maybe, I don't know, first week in March, maybe I'll take time off and do something really good. Yeah.
Yeah, I think that's beautiful. And I do, I'm part of a creative writing studio. I'm a creative writing coach as well. And I think a couple of years ago, we all got together. There's 10 of us. I think it was a couple of years ago. And maybe even pre-COVID, or maybe it was because I'm not exactly sure when it started, but it was pretty recent. We were like, Februaries are hard. So we closed down for a week in February because Februaries are hard. And that's like literally what we put on our out of office messages. We're like, we're closed. February is hard. See you in a week. And I just, love that. Love the permission to do that. So may we all.
Yeah, may we all do that. The other thing is we are mammals, and
I feel it. The light.
Right. Like we would all be, eating our gruel and going to sleep soon.
Absolutely.
Right? Like,
as soon as it goes dark, I'm like, bedtime, 5:00.
All right. Like, why not? Why every other species slows down a little bit. So
it's true.
We should, what did I said, we are mammals with overdeveloped brains so that we can worry about things.
Yeah.
That is basically.
Vicky, you're so wise. I've enjoyed this conversation so much. Thank you. I feel like people are going to learn so much from this. And I think if I can speak for what I imagine a lot of people may feel as they listen to this episode is that it is truly my first time talking to a medical professional who has any awareness, any knowledge, and any curiosity and openness to what it's like to live in a fat body. And it's amazing to me. And I'm so grateful to have had this conversation because it does give me a little bit of hope as well. So thank you. And I hope that's what people take away as well, is that people like Vicky do exist out there. We can empower ourselves to ask those questions as much as we're able. And, you know, I feel like the more we do that, the more we advocate for ourselves. Maybe doctors start to get a little bit of the message and we can just start to create, I guess, change from the ground up. And unfortunately, we have to do all the emotional labor of that as marginalized people. And I don't know, we just have to deal with it as best we can. But it's so...
And sometimes smiling and waving is the best way to do it. My sister always used to send me that gift when I was at a place that I would just smile and wave and be like, smile and wave and be like, and then I'm going to do whatever the F I want anyhow. So I'm going to smile and wave at you.
Prescription, yes. Please. Okay, see ya.
Thank you so much. Have a lovely day.
Right? Thank you, Vicky. It's been such a joy.
Thanks for having me.
Yeah. Before we go, I'd like to read a poem because poetry can reach our hearts in a different way. Poems can have us feel in a different way. And that's what this podcast is all about. Expanding our hearts, deepening our empathy, and inviting in joy. So each week, you get a new poem. Dr. Vicky Borgia is deeply passionate about her patients and that commitment to their dignity and compassion for their experiences and her desire to not cause further harm to people living in marginalized bodies is deeply inspiring. And it had me thinking about this intricate poem by Manahil Bandukwala called The World Within the World Within You. So here it is. Oh, and under the title, there's a little kind of like a subtitle. It's a quote. There are worlds between my toes. I am a bear. And that's a quote by, it has a line that says, a bear, and then in parentheses at _single_bear, parentheses. All right, here's the poem. There are worlds within the worlds within you. Each world spores its own fungi. The forest hidden in your ear canal is spongy. All the leaves fire-like, all the dried up streams, all the little chipmunks ferrying acorns across your helix. Press your right ear to a pillow. Your worlds sleep when you sleep to the distant rumble of an always shaking earth. The garden in your hip crease is damp from autumn rain. I tried to tread carefully, but there are so many mushrooms, each one reaping the harvest of early spring. There are worlds that rise with you each day, while others exist only between moments. The moments where you scrunch up your shoulder blades creates the inner curve of a waterfall basin down to your tailbone. I swim in the pool under mist, the nudge of each breaststroke, the light airiness of a kiss. Thank you for joining me today. My hope is that you're feeling a little less alone and a little more seen. So until the next episode, you can find me on Instagram at fatjoy.life, on YouTube at youtube.com/@fatjoy, and on Patreon at patreon.com/fatjoy. Please do check out the show notes for how you can connect with my amazing guest and for the links to the poem. All right, lovely. I am sending you off with my best wishes for an abundantly Fat Joy day, and I look forward to talking to you again soon. Bye-bye.